Okay, Dr. Rafich here from Vet Triage. We are continuing on with this 2021 edition of Veterinary Surgery. We are talking about calcanean rupture repair in a cadaver study for dogs, the effect of calcanean bone tunnel orientation for teno-osseous repair in a canine common calcanean tendon avulsion model. The picture here shows the area of the body we're talking about. It's right here. It's the Achilles tendon, known with by layman's terms. And this, for surgeons, is a very frustrating disease or trauma that dogs sustain. It's not that common, but it's common enough that this is a very frustrating repair. So let's get into it. The study comes out of the University of North Carolina as well as Purdue University in Indiana. The objective is to determine the influence of bone tunnel anchoring technique on teno-osseous repair of the common calcanean tendon in dogs. So this is called the common calcanean tendon because it has multiple portions of it that make up the entire tendon, and it attaches to the calcaneus of the ankle, the tarsus. It's a randomized ex vivo biomechanical study, 42 limbs. The methods here, they place the limbs into one of three anchoring techniques, and that's also shown in the picture here. The single transverse tunnel, so that's this one here. Where is it? Yeah, A right here so this A is a transverse calcanean osteotomy. This is the surgical trauma they caused, and then for the picture here, picture B, there it is, transverse tunnel. That's B. Then C shows the vertical tunnels. So that's C, the vertical tunnel right here. And then the modified bone tunnel, which is D right here. And then all of them had a 3-loop pulley pattern using size 0 polypropylene suture. Results found that the only difference detected consisted of the transverse tunnel construct yielding at loads 25% higher than the modified bone tunnel. So that's B, yielded at loads 25% higher than D. Conclusion: although yield loads were lower in this group here than other groups, the bone tunnel anchoring techniques tested here did not appear to influence the biomechanical properties or gapping characteristics of teno-osseous repair in the canine common calcanean tendon avulsion model. Therefore, all drilling techniques and bone tunnel orientations in this study are viable. Introduction. Now, the introduction here you need to know for your surgery boards if you're a surgery resident or a surgery intern watching this. Tendinous injury affecting the gastrocnemius tendon in dogs is observed to occur at the enthesis, musculo-tendinous junction, or mid-body of the tendon. So that's what that's saying is enthesis is where the tendon touches the bone. Then the musculo-tendinous junction is where the muscle and tendons, so muscle or tendon, wherever that occurs in that particular patient, or the mid-body of the tendon itself, so in the middle here. So either the junction of muscle and tendon, middle of the tendon, or where it attaches to the bone. Tendon rupture occurring at the enthesis occurs with variable degrees of avulsion of components of the common calcanean tendon and can vary based on patient signalment, chronicity, level of degenerative tendinous pathology. Complete rupture involving all components is seen in 27 to 43% of dogs with this injury. Partial injury and associated rupture with the superficial digital flexor tendon remaining intact occurs in 22%, with injury affecting the gastrocnemius tendon alone seen in 20% of cases clinically. In dogs, avulsion of the gastrocnemius tendon and accessory tendon from the calcanean tuberosity are commonly repaired surgically using a combination of bone tunnels and core suture patterns to oppose the avulsed tendinous tissue to the enthesis of the gastrocnemius tendon. Debridement or osteotomy of the proximal aspect of the tubera calcanei is frequently employed to remove sclerotic bone, peritendinous osteophyte or enthesiophyte formation, and encourage healthy bone bed to promote teno-osseous integration. Temporary rigid immobilization of the talocrural joint, that's the tarsus, is then typically performed to limit flexion and decrease the strain experienced at the repair site. Despite excellent outcomes, A study reported 30% complications. Limited hind limb motion and joint stabilization are required to counteract the force sustained by the calcanean, common calcanean tendon during weight bearing, which is calculated to have about 400 newtons at a trot for a 30 kilogram medium to large breed mixed dogs. A study demonstrated that although talocrural immobilization significantly reduced gastrocnemius tendon strain compared with normal controls, continued isometric gastrocnemius muscle contraction still caused continued strain at the enthesis. A canine common calcanean tendon avulsion model in rats showed that healing at the teno-osseous junction progressed slowly the first 4 weeks. This was then followed by 6 to 8 weeks of rapid healing, tendinous organization, and bony ingrowth, resulting in a 5 times increase in strength compared to immediately post-operatively. Close apposition of the tendon to bone interface with prevention of the gap formation, which is less than 3 millimeters during this protracted period of healing, is critical to allow progression of osseous integration and tendinous remodeling. Surgical techniques without use of immobilization for 5 to 9 weeks may predispose to failure. In dogs, it is also essential that early controlled exercise and progressive controlled loading be used postoperatively to allow for tendon remodeling, collagenous realignment, and prevention of fibrous adhesions. So just immobilizing the limb alone to allow for the area to heal is a challenge, and there's many different ways of immobilizing the limb, and also trying to balance immobilizing the limb with also some sort of gradual physical therapy or controlled physical therapy, combined with how difficult this is to repair, it contributes to why this is such a frustrating disease. Multiple surgical techniques have been described to anchor the suture to the calcaneus. A single bone tunnel drilled in the calcaneus, oriented in a mediolateral direction or transversely, through which suture is then passed, has been described to secure the common calcanean tendon to the calcanean tuberosity. A double drilling technique was also described, where bone tunnels were drilled in a centromedial and centrolateral direction, distal to the gastrocnemius tendon enthesis. A modified tunnel technique was described, comparing a 3-loop pulley and double crack-cow pattern for repair following gastrocnemius tendon avulsion. All right, materials and methods. The insertion of the gastrocnemius tendon and accessory tendon formed by the musculotendinous contribution of the biceps femoris, gracilis, and semitendinosus. Muscles onto the dorsocentral and proximal medial aspect of the calcaneus, respectively, were preserved. So that you need to know for boards. And then, of course, we have the picture here showing all the different techniques used. This is the device they use to test the cadavers. So again, there's A, B, C, and D. And just to read off what those are, a photograph of the biomechanical testing apparatus with a musculotendinous specimen loaded within the custom testing jig. That's A. And then B shows the modified tunnels, C is the vertical tunnels, and D is a single transverse tunnel. And that's right there. Results. When you look at the bone tunnel orientation, the transverse had a yield load of 163.37 newtons, a peak load of 174.99 newton, a failure load of 174.84 newton, and a stiffness of 6.02 newtons per millimeter. The vertical technique had a yield load of 158.73 newton, a peak load of 173.3 newton, a failure load, which is the same, and then stiffness 5.61 newton per millimeter. And then finally the modified technique, 132.68 yield load newtons, a peak load of 165.63 newton, a failure load of 165 newton, and stiffness of 5.75 newton per millimeter. Then when you look at the tunnel orientation and the 3 millimeter gap formation, the transverse technique had a 85.7% with a force of 143.7 newton. The vertical technique had a 92.9% and 127.23 newton force. The modified had a 92.9% and 135.08 newtons for force. Results. The left and right hind limbs were equally distributed. Constructs, so this is where they start using abbreviations, so I gotta go back and forth. Constructs in the transverse tunnel group had greater yield loads at 25.4% compared to the modified bone tunnel, but not the vertical tunnel constructs. The vertical tunnel constructs yielded at higher loads at 19.6% compared to the modified bone tunnel constructs. There was no difference between groups regardless of bone tunnel orientation on peak loads, failure loads, or stiffness. Bone tunnel orientation did not affect the loads required to produce a 3 millimeter gap, with no difference seen between groups. Two modes of failure were observed: suture breakage and suture pulling. The occurrence of suture pull through the transverse tunnel technique was 79%, the vertical tunnel 64%, the modified bone tunnel 57%. And this was the most predominant mode of failure seen. Discussion. All methods examined represent viable options for reattaching the common calcanean tendon to the calcanean tuberosity following avulsion in dogs. Degenerative pathology in the distal calcanean tendon, sclerosis of the calcanean tuberosity, close proximity to the superficial digital flexor tendon, and peritendinous osteophyte formation may influence drilling orientation and technique intraoperatively in clinical cases. The superiority of the three loop pulley compared to a single and double locking loop patterns is documented. Loads to construct failure were greater than those previously reported by other investigators. Larger sutures have increased tensile strength and improved biomechanical properties of flexor tendon repairs. The use of the vertical tunnel and the modified bone tunnel create a more uniform and well-opposed anastomosis between the distal common calcanean tendon and the calcanean osteotomy surface. In the transverse tunnel constructs, upon incremental loading of the construct, during removal of the suture slack, distortion of the common calcanean tendon at the bone-tendon interface without gapping at the teno-osseous junction was observed, which may affect union and ingrowth clinically. The gastrocnemius tendon and accessory tendon have a combined tendinous width that is smaller in size than the corresponding enthesis upon the calcanean tuberosity in non-pathologic canine common calcanean tendons. When tension is applied to a repaired construct using a 3-loop pulley pattern, sutures glide through the tendinous tissues and bone in a pulley-like fashion so that equal load is distributed by each of the 3 loops. The 3-loop pulley technique uses 6 suture strands that traverse the tenorrhaphy, while the locking loop patterns consist of 2. In constructs where the locking loop pattern is loaded, the suture interacts with collagen fibrils as the loops tighten. However, as the locking loop is loaded, subsequent length is added to the suture strands that bridge the tenorrhaphy, leading to earlier gap formation and separation at the enthesis. This phenomenon may be reduced by tightening the tendon ends. However, this increases bulk at the tenorrhaphy site. Tension redistribution occurs more easily if each loop is tightened sequentially during pattern completion and the ends of the tendon are approximated prior to suture knotting. Gap formation of less than 3 millimeters is desirable due to the negative effects that could otherwise occur during normal progression of tendinous healing. The mean loads to cause 3 millimeter gap formation, which is 135.17 newtons, was greater than reported in other studies, which were 55.85 newtons and 49.4 newtons. Suture breakage occurs typically due to abrasions or weakness of suture when interacting with bone edges, surgical instruments, or suture needles. Overloading of suture resulting in rupture may represent a more likely alternate cause of suture failure. Suture pull-through occurred as a predominant mode of failure when the 3-loop pulley was used for the primary repair, which agrees in other studies. Suture pull-through has been shown to be affected by suture tension on the repair site, knot tying, suture pattern, suture configuration, suture selection, and the integrity of the anastomosed tissues. The use of adjunctive techniques such as autologous tissues, musculotendinous grafts, epitendinous suture, synthetic mesh, and tendon plating may also be employed. In conclusion, despite yield loads differing less than 25% in the modified bone tunnel group compared to the other groups, bone tunnel drilling techniques and bone tunnel orientations were observed to have no effect on the biomechanical properties or gapping characteristics following teno-osseous repair in a canine common calcanean tendon avulsion model. All of these are viable. So for pet owners and for veterinarians, this is a very frustrating disease. You can see how complex these are. These are all different repairs that are all experimental on cadavers. We don't know how they would work in a real study or in a real patient, but it just you have to bear with. You have to appreciate how difficult this disease is, this trauma is, and both for pet owners and veterinarians. So realize that if you're undergoing multiple surgeries or even risking amputating the limb because of recurrent surgical failures, it's no surprise. This is a very challenging disease or trauma to repair. All right, guys, we'll see you in the next video. Thanks so much.